Well, now let's talk about Indiana's COVID crisis. The state just reported the second highest day in the pandemic so far, and the state says most of those new cases are the Omicron variant. More than 16,000 new cases were reported on Wednesday. The state health department says 85% of those cases are from Omicron. Now, in January alone, Indiana has reported more than 222,000 COVID cases. So here's the harsh reality. That's one case reported every 7 seconds over the last few weeks. And we are not just looking at one area. All 92 counties are included in this because we are all in red, as you can see there. That means the virus is spreading fast in all parts of our state. Now, because of those high case numbers, more districts have moved to e-learning. Randolph Central will be virtual for the rest of the week. That's due to an increase in staff COVID cases and a lack of substitutes. Clinton Prairie will be e-learning this week also. Now, the district tells us 21% of students either have COVID or are currently in quarantine. Plus, Pioneer Regional Schools, they're online through tomorrow. One of the local front lines of COVID, IU Health's Methodist Hospital asked a FEMA team to stay on another 30 days because they're just so busy right now. More hospital staff is also getting sick with COVID or has to quarantine because of being exposed to the virus. The surge in COVID cases from the Omicron variant is still not likely at its peak here in Indiana. Dr. Mark Lutemeyer says those numbers are on their way up again, with 634 COVID patients in hospitals across the IU system. 175 of those are at Methodist.
We have seen some increased discharges lately, but we are also seeing the total number of deaths rise. And so this has been the highest 30 days of deaths that we've seen since 2020's winter surge.
Of the patients IU is seeing in its hospitals, only on a single day, 70% are unvaccinated. Dr. Lutemeyer hopes the arrival of those at-home test kits will make it more convenient for people to know if they're positive for COVID.